Good morning. My name is Elsie Fraley. I'm with IT Education. You guys are here to do basic scheduling, learn how to do basic scheduling through APM, correct? Okay. So I've already logged you into the training database. You guys have taken the APM View Only and Printing WBT. That covers how to search for a patient, the proper way to search for a patient. We'll also do that in class just to give you some hands-on. It also talks about where you can find different things in APM. Basic navigation really is what that WBT covered. It also covered the printing process. So unless anybody has any questions about how to go to print the appointment schedule for your clinic today, we won't do that in class. You can always refer back to that WBT, okay? All right, so I've already logged into the training database so that we can do whatever we want in here and not mess up the system. But when you guys go to log into APM, you do have a manual if you want to open up your manual. There's, of course, an index there. If you go to page 5, where it says help, it says that it's best to log into APM through the actual program and not the icon on your desktop. Sometimes those icons can get corrupted, and it's best to just go through the actual program. A lot of people do use the icons and don't have any issues, but then there are some users that when they double click on the icon to log in, they get an error, okay? So when you guys have logged into your computer with your link blue credentials, when you go to access APM, it's going to automatically log you in. So I'm going to pull it up on the screen. You guys can follow along, but when we get to the ambulatory folder, because those are training computers, you will not see APM Prod. But when you guys go to log into the live system, you'll come down here to the start menu and you'll look for your ambulatory folder. Does everybody see their ambulatory folder? You click the drop down and there's your APM Prod. Now I'm not going to click on it and log into the live system because I really don't have a need to, but you would click on APM Prod. And it will automatically pull up APM and log you in. You do not have to use a password at all. It's going to log you in with your link blue credentials. Any questions about logging in directly to the program? Okay. Now across the top, you've got some icons that are visible right now. We don't have a whole lot of icons available yet because we're not in one of our folders. But I do want to talk about some of the icons that we see now. If you are just glancing across this toolbar, do you see an icon that looks like a bloodshot eyeball if you just glance at it? Does everybody see the red arrow pointing to the left? And it looks like 3 little lashes coming out. If you hover on it, it says log off. That is the proper way to log out of APM. Please don't ever go to the X and hit the X to log out. That will just close the program. It will not log you out. If that happens and you try to log back into APM, you're going to have to call the help desk because you're going to get an error. You'll have to call the help desk. They'll have to boot you out on the back end, and then you'll be able to log in. Okay? So proper way to log out is always, always use the bloodshot eyeball. Okay? The other icon I want to talk about is the one that looks like the gear icon. If you guys want to go ahead and click on that, it's going to bring up menu options. So if you go to page 7 in your manual where it says menu bar, now for you guys, you're only going to set options on this first tab that is scheduling. I highly recommend that you go in and set your schedule department so that whenever you go to schedule an appointment, your department's going to automatically fill in for you, okay? Location, I do not recommend that you set that because every department has different locations that they use. Some are physical locations, some are specialties or teams within your department. I can't tell you what your specific department locations are because every department has their own locations. And within your department, each provider that has a schedule in APM, they could have a different location. So you might have 10 different locations in your department. One provider only uses 3 of those locations on their schedule. Another provider uses 5 of those locations, so on and so forth. You need to find out the individual providers, what locations they have on their schedule. And then it comes down to when you go to schedule an appointment, whichever provider you have in the resource field, you want to make sure that you are scheduling that appointment for that patient based on their chief complaint, you are scheduling it under the location that provider wants those type of appointments to be scheduled to. Does that make sense? For instance, we're going to use Dr. Fons at Family and Community Medicine. Let's say she has a patient who calls, an existing patient that calls in sick and needs to be seen. She might want that scheduled, her sick visit scheduled under her blue team or her green team or whatever the case may be. If a patient comes in for an annual exam, she might want that scheduled under her yellow team. Does that make sense? So depending on the actual chief complaint, the reason for the visit, the provider that you have filled in, you're going to have to make sure you select the correct location so that their schedule flows the way they want it to flow. Okay. Don't recommend that you set resource either, because you're going to be scheduling for more than one resource. If you put a default resource name in here, it's always going to fill that person in, and you're going to have to remember to go change that. Okay. The other thing is coverage type. We're not going to do it in class, but you can set your coverage type because you guys are only going to be scheduling medical appointments. And we'll talk about the different coverage types when we actually get into schedule an appointment. Okay. If you have anything filled in any of these fields, whether you do or not, I want everybody to come down and click cancel. But in the live system, you would actually click OK, and it will save those defaults. The next time you log in, those defaults will be there. Okay. Any questions about setting up your default? Okay. All right. So if you go to page 8, talks about the navigation pane. Over here on the left-hand side where it says function, this is where you're going to open up folders so that you can toggle between different folders as you need to. In this class, we do everything out of the scheduling folder. I'm going to go ahead and show you how to open up the registration folder so that if you want to go from your scheduling folder directly to your registration folder, you can do that without opening up multiple folders of each one. You only need one scheduling folder open, one registration folder open. If you have multiple folders of each of those open, you're going to get confused because what you see in one folder for registration won't be in your other folder for registration. You'd have to pull up that information in that folder. So it's best to just have one folder of each of these open. Okay. Now I'm going to show you the way to open these folders so you can actually toggle between the two folders when you want. Over on the left-hand side, you see functions, you see practice management, and then you see patient management. Go ahead and click that drop down. Now we only use the registration, and some users use the notes folder. We'll talk about notes folder in just a little bit. Go ahead and single left click on the registration folder. It's going to open up the registration folder, and you see the tabs that are within this folder, summary, patient account. Right up above that tab, you see, I guess, another tab that says registration. That's your registration folder. We're in that folder right now. I'm going to go back over to the left-hand side and click that little arrow up to collapse the patient management main folder. Then I'm going to come down to the scheduling and click the drop down there. Appointment scheduling is where we're going, but don't do anything yet. Scheduling activities and scheduling reports is where if you want to print something out of APM, appointment schedules, whatever, you can use one of these two folders depending on your preference of how you want that report to look. Again, that APM view only and printing WBT did cover that. And then in the back of this manual, we also have the printing processes here. But what I want you to do is I want you to right click on appointment scheduling. Make sure you right click so you get these options. And you'll come down and always select the bottom one, the last one that says open appointment scheduling in new window. Go ahead and click on that. That's going to open up your scheduling folder. And you see you've got 4 tabs in the scheduling folder. Right up above those tabs, you see patient scheduling. And if you look to the left of that, you see registration. I'm going to come down to the right of scheduling and click that arrow up to close that because I've got the folders open that I need. I don't need to open up multiple folders. But right now we are in the patient scheduling folder. If you notice, the patient scheduling, appointment scheduling folder is kind of dark gray. If you look to the left, you see registration and it's light gray. That's how you tell which folder you're in. Plus, the tabs will let you know which folder you're in. If I wanted to go from the scheduling folder to the registration folder, I just go up here and click on the word registration, and it takes me to the registration folder. I'm going to go back to my scheduling folder. Okay. Any questions about opening up multiple folders? Okay. Now, you guys are not going to be creating new patients to UK Healthcare. If a patient calls in and they're brand new to UK Healthcare, you're going to give that to somebody that's had the full class training. Because what that means is the registration folder has to be completed for the patient before an appointment can be scheduled. You guys are not being taught how to do a lot of the things in the registration folder. We do ask that when a patient calls in to schedule an appointment, we don't know the last time that patient, we had contact with that patient or anybody had contact with that patient. So we always ask that once you schedule the appointment, you go to the registration folder and you verify their address, their phone number, their primary care physician, and also their emergency contact, okay? So we're going to go ahead and schedule an appointment. We are on the patient scheduling tab, which is where you're pretty much going to work out of. Once we schedule the appointment, I'm going to show you a shortcut that will open up the registration folder, and your patient will be in context in that shortcut. If I'm in the patient scheduling folder and I have a patient in context and I click on the registration folder, that patient will not be in context. I would have to click the binocular and go find that patient again. But if I go through my little shortcut from the scheduling folder, that patient will be in context. So I just go check their phone number, emergency contact, address, and PCP, and I'm finished. Okay. All right. So if you go to page 8, talks about searching for a patient. The WBT covered why we have to use these 3 searches and only these 3 searches. There are more searches available in APM, but we do not use them. We did not go live with APM until July 2012. Prior to that, we had a separate scheduling system and a separate registration system. With APM, we have both of those in one system, which makes it a lot easier. It's seamless, it's faster. When you search for a patient, these 3 searches are the only searches that will first look locally in APM. If it does not find your patient in APM, it will automatically behind the scenes go out through EPI to HQPM, which I call our mother system, and search for the patient there. If they've been seen anywhere at UK since we opened the doors in 1962, they're going to be in HQPM. They might not be in APM because they haven't been seen since we went live with APM. If that happens, when you get the results on your patient, they're going to be resulted, their line will be shaded yellow. That means they've not been seen since we went live with APM. And if you click on that patient and continue, it will take you to the registration folder, and you will have to fill out a lot of required fields in that registration folder that you're not being taught how to do. So if you ever get results on a patient that's shaded in yellow, you will give that to someone that's had the full class that can complete that registration folder for that patient. Does that make sense? Any questions about that? Okay. Now, there are 3 searches that we use at UK: medical record number, social security number, patient name, and date of birth. So we're going to go ahead and do those 3 searches. But before we do anything, I do want to talk about right here where it says patient, there's a free text field. I don't click in there and start typing anything because you're going to need to click an icon to the right there. There are 3 icons available. The first one is the binocular. If you hover on it, it says search. That's how you're properly going to search for your patient. The second icon, which is the magic wand, please don't ever use that. If you click that icon, it will bypass searching for your patient, and start adding them as a brand new patient. Do you want to do that? Do you want to take the chance of not finding the patient that already has a medical record number in the system and creating them as a new patient, which creates a new medical record number for them? You would end up creating a duplicate number. We don't need that because that compromises patient care. Okay. The last icon is memo. We'll talk about memo appointments. We don't usually do it in this class. It is in your manual, the instructions on how to do a memo appointment. So we just talk about it. But I want everybody to go ahead and click their binocular icon. It's going to bring up the patient lookup box, and it should default to search by patient name and search by to date of birth. Mine only has patient name in here. But in the live system, it will default to patient name and date of birth. We are going to search for our patient using a medical record number. So I want you to either click the drop down in the search by where the patient name is. The way I like to do it is I like to stay away from the drop downs. To me, it's faster and easier to do it this way. And sometimes those drop downs, if you don't select it off of the drop down, even though it looks like it's defaulted in that field, if that drop down is open, you have to click it off of that drop down, or the system gets a little confused. So what I like to do is just take my cursor and single click where it says patient name. It's going to highlight it, and I'm going to type an M. That's going to change it to medical record number. Okay. So does everybody have that in the search by field, medical record number? Now, if you have date of birth in the search by to field, please click in that field and hit your delete key. Don't hit your backspace or your space bar or anything like that. Make sure you hit the delete key to delete the date of birth out of there. When you're searching by medical record number, please make sure that's the only parameter you have filled up in the search field. Okay. Now to the far right, it says search for. Go ahead and click your cursor in there. I've given you a plastic sheet with a training patient, a practice patient that we're going to use in training today. You see the name, date of birth, social security number. Do you see a medical record number? No. That's because how many, well, in training, we only have one medical record number. But how often when a patient calls in, are they going to know their medical record number? They're not. Okay. So, but I do want to show you how to search for a medical record number just in case you've got their number. Go ahead and search for it that way. That's probably the best way to find the patient. Now, before you type anything in this field, what you need to know is that when you're searching for a patient by medical record number, you have to have 9 digits. Some of UK medical record numbers are only 7 or 8 digits long. You would put 1 or 2 leading zeros in front to make it 9 digits, okay? Since there's only one medical record number in the training database, we're all going to use the same number and search for our patient. So we're going to type 0, 33, 33, 66, 66. Now you see the button that says local search and the grayed out enterprise search. In the live system, you only have one button that says search all sources. That means when you click your search button or hit your enter key, either way works, it's going to first look locally in APM. If that patient has been pulled into APM, you'll get your results down at the bottom, and they will not be highlighted in yellow. You select that patient and you schedule the appointment, okay? If that patient has not been pulled into APM, since we went live with it, they'll be resulted at the bottom, but they'll be shaded yellow. You won't proceed with that. You will get someone that's had the full class that can complete that full registration folder, okay? So I'm gonna go ahead and click my search button. And if you look down at the bottom, I see Isabella Cullen. Is that who you guys see? Is that your patient that's on your practice sheet? Is that your practice patient? No. That's just to show you how to use medical record number to search. Now, is she shaded yellow? If that was my patient, then I could go ahead and single click and proceed with them, okay? But that's not my patient. So what I want to do is I want to go up and search for my patient by social security number. So I'm going to go up in the search by field where it says medical record number. I'm going to single click in there. It's going to highlight it, and I'm going to type an S. That's going to change it to social security number. If you have the drop down open, make sure you scroll down on that drop down and click it off of the drop down. Then over to the far right on my plastic sheet for my practice patient, I've got a social security number for that patient. Everybody's got their own separate, different patient. So go ahead and type in the social security number that's on the sheet for your patient. You do not need dashes or slashes. You could put them in there if you want. And then I'm just going to hit my enter key, because remember, clicking the search button or hitting enter, both ways work, okay? Now, we do reuse these patients in other classes. So what I want you to do is I want you to look at this patient name. Did everybody find a patient, a result with that social security number? No? Okay. Hang on one second. I didn't mean to do that. I meant to. Okay, so everybody found their patient listed down here with that social security number, right? Okay, now I want to do one thing. Just watch the screen. I'm going to key in a social security number. I'm just keying in a bunch of numbers. Okay. And look down at the bottom. I did not get any matching results. Okay. That does not mean the patient is brand new. So what I want you to do is turn your, in your manual, go to page 21. In APM, the social security number is a required field. When we are creating a patient who is brand new to UK, we cannot leave that social security number field blank. Prior to APM, we could leave it blank. So the system would just generate a social security number if we couldn't get the patient's social. Good luck trying to figure out what that is though. But you may run across a patient if you search for them by their social and not find them. That does not mean that they are brand new. It could mean that they are in the system with one of the 4 default numbers we use in the place of a social security number based on the different scenarios. So on page 21, where it talks about social security number, it tells you there why we have to have the social security number, patient identification, make sure we have the correct patient, and billing purposes. When we submit the bill for this visit to the patient's insurance company, one of the pieces of identifying information that has to go with that bill is the patient's social security number. If we do not have their social security number, then when we submit that bill, we could end up getting a denied claim from the insurance company because the information doesn't match what we have for the social and what they have for the social. So when we check patients in for visits, which you guys won't be doing, they do their best to try to get that patient's social security number so the billing process happens a little bit smoother. But if you look in your manual, the default number of all 8s for a social, that would be for patients who are foreign patients and they just don't have a social, okay? If the patient at time of registration doesn't know their social security number, a lot of people don't have it memorized and don't carry it with them, we will use all 6s. Or if I was calling in for my child and I don't have their social security number handy, they would use all 6s for my child. Does that make sense? Now, if the patient refuses to give us their social security number, it's their right. They don't have to give it to us, but it will affect whether they get a bill or not for these services. We will use all 3s, okay? In the case that they will give us the last 4 digits of their social, we will use 3s and then the last 4 digits of their social. But we always do try to get the patient's social security number when we are creating them as a new patient, especially at time of check-in, okay? All right, so just because you don't get any results with your social does not mean that the patient is not in the system, okay? Now, if a patient's calling in, they're not going to have a medical record number. Well, they'll have one, but they may not know that number. So you can skip that search. A lot of users will also skip the social security number search and go straight to the 3rd search, which is patient name and date of birth. That, to me, is my preference, patient name and date of birth, if I don't have the medical record number. So what I'm going to do is click right here where it says search by. It says SSN. I'm going to click in that field and type a P. It's going to change it to patient name. And then I'm going to click in the search by to field and type a D. When you're searching for a patient, you have to have the patient name and the date of birth in your search parameters, okay? Do not ever use a search by 3. The system is not set up to first look locally in APM and then go to HQPM if it doesn't find the patient in APM. If you put in a 3rd search, it will actually confuse the system. You're probably going to get an error. Now, over in the search for field where you see that social, go back to page 9. And When you enter the patient's name, you have, I'm sorry, it's page 8, talks about how to enter that patient's name. You have to use the full last name, and you have to capitalize the first letter of the last name. So on your plastic sheet for your training patient, go ahead and type your patient's last name. Has to be full last name. You have to capitalize the first letter of the last name. And then you put a comma directly after that last name. It's up to you whether you put a space between the comma and the first name, but you also have to type the first name, full first name, capitalized first letter of the first name, every time you search for a patient. Please make sure you do it that way, okay? I know in AEHR and some of our other systems, you can use partial name and you don't have to capitalize anything. You cannot do that in APM. In order to get it to properly search locally in APM first, if it doesn't find the patient in APM, to ensure that it goes out to HQPM and looks for the patient there, you have to do it exactly this way, okay? All right, I'm going to click in the search for field below the patient's name, and I'm going to enter the patient's birthday that's on my sheet. You don't need the dashes or slashes when you're searching. You can use them if you want, but to me, that's 2 extra clicks I don't have to do. And then you either click your search button or hit your enter key. Down in your results area, did everybody find their patient? Awesome. We're going to go ahead and single click on that patient and then click OK. Any questions about the 3 different ways to search for a patient? If you had the drop down open, you probably saw that there's other options to use to search for your patient, but we do not use those at UK. Just ignore that they're even there, okay? All right, so we're on the patient scheduling tab. We've got our patient in context. We're now ready to schedule an appointment, okay? From the WBT, this area right here that I'm circling on the screen, those are future appointments, not only your department appointments, any department at UK that they have an appointment in. You can't do anything with those appointments. You can look at them, but if you need to, cancel one or reschedule, you will go to your appointment activity tab for this patient and select that appointment and either cancel or reschedule, okay? All right, right here where it says coverage type. If you go to page 9, patient scheduling tab, highlighted in yellow, it says scheduler cannot schedule outside their own department unless they've been sanctioned to do so, as in the case of ancillary scheduling or when scheduling lab appointments. So if your provider in your department is sending this patient to the lab, they have to have an appointment, okay? You're going to have to schedule that appointment. We will do a lab appointment in another exercise just to walk you through that, because there's a little bit of difference in what you enter when you're scheduling the lab appointment, okay? All right, if you turn your page, every field to schedule an appointment is listed in this manual. So if you want to follow along as we complete these fields, I'm going to tell you the information to enter into these fields because we're in the training database and we don't have every department in here. So I'm going to tell you which department, what location, which resource, what appointment type. Does that make sense? Okay. Now, if you look on the top of page 10, it does talk about coverage types. It is critical that when you schedule an appointment, the coverage type matches the type of appointment the patient is being seen for, okay? And then as far as check-in goes, they have to ensure that if the patient's coming in for a medical appointment, they're checking them in for that. When they go through the registration folder to verify everything, they have to make sure that we have a policy listed on the policy tab with the same coverage type for the type of appointment they're being seen for, so that the billing process happens smoothly, okay? So if you look at the different coverage types, you've got behavioral health to be used only for mental health unless the appointment is accident or work related, and then they would use workers' comp or motor vehicle. Dental, I don't think anybody uses the dental. We had a dental clinic over at Polk Dalton, but I think they closed, and I think Hazard had one, and I think they may have closed. So I'm not sure if anybody's using dental, but you guys won't be. Medical is what you're going to be using. It's to be used for all medical and post-op transplant visits, okay? Motor vehicle, if the patient calls in and said I had a motor vehicle accident, you are not going to schedule that appointment. You're going to give it to somebody that's had the full class because they'll schedule it under the motor vehicle coverage type. And then they have to complete an ailment. Ailments are attached to motor vehicle and workers' comp appointments, okay? Other, anybody in here from ophthalmology? Anybody in here from plastics? Okay, those two departments will use other the majority of their time when they schedule appointments. Unless it's motor vehicle or workers' comp, then they'll use that. But other is to be used for ophthalmology, research, pre-transplant, prisoners, or special billing, agency special billings. You guys aren't going to schedule any of those. Yes.
Pre-transplant, would that be you coming from that work? Because I wouldn't schedule that.
Yeah. Yes. Yeah, if they're coming in for lab work for pre-transplant, you will schedule that lab appointment under the coverage type of other. Okay. Okay. I don't think your department uses other. It's just the actual plastics department. But check with your manager because you might. I don't want to say that you won't. I'm not sure about that though. Okay.
We do have some plastics over there.
Yeah. Then you've got your workers' comp, and then it also goes in to say Ryan White VA financial assistance could fall under any of these coverage types. So if Ryan White is paying for this patient and they have had a motor vehicle accident, it might be possible that Ryan White is going to pay for that visit for the motor vehicle accident. Maybe I would think in the case that maybe somebody didn't have insurance that caused the accident, so there's no motor vehicle to bill to. So if you ever run across one of those and you're unsure of what to use, call your insurance helpline and they'll help you out, okay? Ailment, it talks about it's accident, injury, or illness related. We're not gonna do an ailment because we're only gonna do a medical appointment. You do not need an ailment with a medical appointment. So to set this up, your patient has called in. We are going to be working at Family and Community Medicine out at Turflet. This patient calls in. They are an existing patient of Dr. Fawn's. They're sick. They think they have the flu, so they would like to get an appointment to be seen as soon as possible, okay? So we're going to schedule that appointment. Now, where it says coverage type, it does default to medical. We're going to skip the ailment field. I'm going to single click in the schedule department field, and I recommend that you do this before you click that drop down. There are over 120 departments, and if you've got your default set for your department, you won't have to do this because it's going to automatically default in for you. What I'm going to have you do is type an F. That's going to take you to that part of the alphabet on the drop down. Now, if you want to click your drop down, you'll see the other departments that are listed for Family and Community Medicine. We want the one at Turfland. So I'm going to single click on Family and Community Medicine Turfland, and that should be my department in the schedule department field. Does everybody have that? All right, hit your tab key, type an F in the location, schedule location field, and then click your drop down. Here, look at all these different locations they have. With Dr. Fawn's, I know that when a patient calls in, they want to be seen. I'm going to schedule them under the green team. This is just for training purposes. It might not be this way in the live system. So for training, we're going to come down and select the Family Community Medicine Green Turfland. Does everybody have that? Okay. Tab to your resource. I highly recommend that. When you start looking for a resource, a PCP, or a referring doctor, that you only use up to the last name only. You can use partial name, but never put anything after the last name. Okay. Now in the resource field, I want everybody to type FAW, and I'm going to stop right there because if I look, it defaulted in Tina Fons. That's who I want. That makes sense? But starting to type the provider's last name will get you really close to where they are on that drop down. So then you can click the drop down, select them off the drop down. Okay. All right, I'm going to hit my tab key. It's going to bring me to appointment types. If you click the drop down, you're going to see that these are the only appointment types that Dr. Fons has on her schedule under that schedule location. She might have other appointment types that she uses under different locations, but for this location, these are the only appointment types that you'll use. Does that make sense? Okay, I'm going to select the established patient. Now notice it says 20 minutes. That's because in training, we've got Dr. Fahn's schedule set up for established or new patients. All of them are a 20-minute duration, okay? If your provider comes in and says, I know that my established patient time slot is only set up for 20 minutes, but I need 30 minutes, you will change your duration in the duration field. But don't put 30 in there because her schedule is set up on 20-minute blocks. If you change that to 30 and you select an appointment, it'll hold the 30 minutes, but it's going to mess up the rest of her schedule because everything is set up on 20-minute durations. So what you would do is just double the duration in the duration field. So if she needed 30 minutes, I would put 40 minutes down here. Does that make sense? Okay, we're not going to change it. Now, you might not see a 20-minute duration for any of your providers because their schedule has them under 5 minutes, 10 minutes, 15, 30. Just each provider has different durations for each of their appointment types, okay? All right, now, referring doctor. There is not a referring doctor for this visit, so you will leave this field blank. You only click the binocular and add a referring doctor to a visit when it's appropriate for that visit, okay? If a provider refers a patient for whatever issue they're having, if they have to come back for a follow-up, that referring doctor that initially referred them has to be attached to that appointment also. So all follow-up appointments, that referring doctor gets attached to until that issue is resolved, okay? All right, click in the comment section. If you go to page 12, it says chief complaint, reason for visit. That is what you should type in this field first. Now, anytime you type anywhere in APM, do not use any punctuation or special characters. If you do, the system will allow you to do it, but on the back end, it's going to cause issues as it flows downstream through different interfaces to get to where it needs to go, okay? You can use the / in this field. Prior to having those other systems reprogrammed to accept a /, if a patient, I was scheduling follow-up appointment for the patient, I refused to type FU because that did not look good at all. I would just type out the word follow-up or return to clinic. But now that we can use a / here, if I'm doing a follow-up, I can do F / U, and it looks totally different than without that /. Always use mixed case also. Don't put all lowercase, don't put all uppercase. Please don't use periods, commas, colons, number signs, any of that, okay? You can use a / but nothing else. So in the comment section, if you look in your manual on page 12, there are 2 screenshots there. The top screenshot is this patient scheduling screen where you see the comment section where we're getting ready to put our chief complaint in. The bottom screenshot is the daily tab in AEHR. And that last column, that's comments, that's kind of, I don't know, outlined in red. That is how those comments get in the field, that comment field in AEHR. It comes directly from the comment field in APM, okay? So anybody looking at the daily tab can look at that comment field and see why that patient's coming in. That helps with patient flow. If I'm in a clinic and we see patients for multiple reasons, I know how to go in and set that room up before the patient comes in so that I just take them directly to the room, get their vitals, whatever I need to. I don't have to worry about coming back and bringing them a gown to undress or whatever the case may be. Does that make sense? It just kind of makes it flow a lot smoother for the clinic and for the patient, okay? So in the comment section, the chief complaint for today is going to be flu symptoms. Now this patient could tell you, well, I can't type symptoms. This patient could tell you, well, I've had fever and chills, nausea, diarrhea, headache, blah, blah, blah. You don't need to type all that in the actual appointment chief complaint. All of those symptoms will go in AEHR where they need to be. This is just for the appointment. Why are they coming in? You can abbreviate, but make sure you use standard abbreviation so everybody knows what the heck you're talking about when they see it, okay? Now over here where it says days and times, you see on or after, it's always going to default to today's date. I'm always going to leave it, so it will give me the first available opening this provider has based on the department, location, and appointment type that I've got selected over here, okay? The only time I will change that is if I'm doing a future appointment and that appointment is not needed for 2 weeks or further out, because when I click open times, and don't do it yet because I want to talk about these other buttons first, but when I click open times, the first available opening on or after this date, which happens to be today, is what's going to populate. If this provider doesn't have any openings today and her first opening is not till Wednesday next week, that is going to be the first appointment that I'm going to see. Does that make sense? Okay. Now where it says any day, anytime, I don't recommend changing that either. Because if the patient says I can only come on Mondays in the morning, based on this location and appointment type, if that provider doesn't have any Monday morning appointments for 3 months, but they've got Monday afternoon appointments, you won't see the Monday afternoon appointments because you said you only want to see Monday AM. So I recommend leaving any day, anytime. That way you can always give the patient the first true opening that provider has in their schedule, okay? All right. Where it says recurring, you guys will not be doing recurring appointments, so you'll never use that button. Link appointments, you'll never use that button either. The button that says use book, you'll never use that button either. Please don't click that button. Even if you know that this provider is booked up and you're going to have to force the appointment in, there's another way to force, and I'm going to show you that, okay? If you hit cancel, it'll wipe your patient out and you got to look them up and start all over, okay? We're going to click open times. So everybody click open times. All right, if you look, it's telling you you're scheduling a new appointment, the department, location, resource, appointment type, patient's name. All of that information is right up here. And then you have your columns. And if you look at the date column, it starts with today because in training, we're lucky we have a lot of openings. If that provider did not have an opening until next Wednesday, that would be the first date I would see, okay? Bottom left-hand side, you see 2/5 to 2/18. That means if I were to use this scroll bar, I can see appointments all the way up to February 18th. If none of those worked for the patient, I could click more times and it would give me the next 2 weeks worth of appointments without having to cancel, go back and change the date over here and click open times again. I can just do it all from this window right here. Does that make sense? All right. You guys are going to pick a time for your patient. It doesn't matter what time. And then come down and click the button that says schedule. And then I want you to stop right there. In the training database, we cannot all click OK at the same time. If we do, we're going to get errors that you will not see in the live system. So the minute this comes up and you've confirmed with the patient that, you know, this is the date and time you've got them scheduled for, you click OK and you're done. Okay. But in training, wait for me to call your name and then you'll click OK. But here's your appointment reminder. You could come down here and print the appointment reminder. If the patient was checking out, I recommend that you do that, print the appointment reminder and send them out the door with it. We're not going to do it in training because we're not set up to a printer. We don't use print and counter form, and we don't use print medical record slip. You guys aren't going to use referral required, but I want you to look at this wait list box. Excuse me. And then look on page 13 in your manual. What does it say there? It says, do not check the wait list box on the schedule appointment screen. If you do, you know how in AEHR, everybody that's got an appointment scheduled for today is on the list and it says pending. When the patient comes in and the patient check-in process is completed and they are acknowledged for their appointment, it will change them from pending to arrived. But if you check this box, this wait list box on this screen, it will never change them from pending to arrived. We don't know why. And to be honest with you, we'll probably never find out why, because we are going to be moving over to the Epic system in June. So pretty much everything is frozen, doing anything new or extra in this system. So don't ever check that box. Instead, if your patient needs to be put on a wait list in your department or wants to be put on a wait list, and your department uses a wait list, you will actually follow the process in the manual, which basically, I'll just tell you, we're not going to do it, but you would click OK to finish scheduling the appointment. And then you would go straight to your appointment activity tab. Your patient will follow you over. You find this appointment that you just scheduled. You right click and you select wait list off of that drop down. And that will put them on the wait list that will not cause issues on the back end. Okay. All right. Okay. And I'm going to click OK. You have completed scheduling the appointment. But again, remember I said if a patient calls in, we don't know the last time someone has talked to that patient. If we need to send out an appointment reminder, or we need to have Telvox call to text, either call or text that appointment reminder to that patient, we need to make sure that we've got the right address. So if we need to mail something out, the right phone number. We're also going to double check and make sure we have the correct PCP in case this provider needs to get a hold of their primary care physician for any reason. And then we're going to look and make sure that the emergency contact is correct. Okay. So instead of, and watch the screen on this, I'm in the scheduling folder. I've got my patient in context. I just scheduled the appointment. If I were to go over here, go up to the top and click on registration, notice my patient is not there. I would have to look them up. But I'm going to go back to my patient scheduling folder. So everybody go back there. On the patient scheduling tab, see where it says patient, and you see comment, and then you see these three buttons. You see the one that says patient info? Go ahead and click on that button. That is going to open up the patient information window. Now, you can see everything that you need to verify, but you can't change anything. So I tell people when this window opens up, just immediately come down to the bottom right-hand side and click on the button that says registration. It's going to open up the registration window through a companion window. Now, I'm going to show you how to make a change in here so that you'll see what happens when you make a change and what you need to do to proceed. But before we do that, if you come into the registration folder and you've clicked on the patient tab and you verified what you need there, and then you click on the account tab and you verified what you need there, if there were no changes, your save button won't be available. So the only way to close this window, we're not going to do it because we're actually going to go through and do some stuff, is look at your icons across the top. We're in the Allscripts PM companion registration window. There's our patient. But look at your icons. Do you see the bloodshot eyeball anywhere listed here? If you don't see the bloodshot eyeball, after you've done your verification, you didn't make any changes and you need to get out of this window, just watch the screen. You guys stay right where you are. I will hit the X just to close this window. The bloodshot eyeball is not there. So I'm not closing the program. I'm just closing that window. Does that make sense? And then I would either hit the X or click OK, and I would be back to my patient scheduling. But I'm going to go back into registration where you guys are. Now you're on the summary tab. Can't make any changes on the summary tab either. You're going to single click on the patient tab. Now you see the fields that are shaded yellow? These are system required fields. You have to have something in these fields or you cannot save if you make a change. Now, the reason I point that out is starting on page 21 in your manual is the registration folder information, and every field in the registration folder on every tab is in this manual. So if you happen to get into one of these fields and accidentally delete what's there or wipe out what's there, and you don't know what goes back in there, we've got defaults that you can use to enter something in that field that's appropriate. And then the next time someone has contact with that patient, they can get that information entered. Does that make sense? Okay. All right. So what we're going to do is when you verify information with the patient, please always ask them the question where they have to give you the answer. Don't say, in my case, or patient's case, are you at 613 Dev Lane? Instead, say, please verify your address. Now, if I look at the address on my patient, when it comes to the drives, the avenues, the streets, those need to be abbreviated. but we don't use a period. So here's what I want everybody to do. I want you to click in your address 1 field, and we're going to change that address. You guys are going to put in whatever address you want for this patient. It's a training patient, doesn't matter what address you use. You're going to use your street number first, then you're going to hit your space bar, and you're going to type in the street name. Make sure you capitalize the first letter. Make it look professional, mixed case. Then you hit your space bar, and your street, your drive, your avenue, your lane, abbreviate those, but do not put a period after that. Okay, question? Okay, you got a box that popped up that said, how do you want to handle this change of address? It means that somebody else on the account tab, a different contact, maybe emergency contact or guarantor, has this same address. When you go to change this, do you want to change it for everybody in the patient's registration folder that has the same address, or just this patient? In this case, I would make sure the radio dial for this contact only is selected and just change it for that contact. Okay? And then you can complete the rest of the address 1. All right, hit your tab key and come to address 2. Those are for apartment, suite, unit, whatever. You can abbreviate, but do not put a period and do not put a number sign. Question? Hang on 1 second. Okay, it's very important when you change something in a field, don't come down and hit save because you're not finished yet. Hitting save will kick you out of the registration companion window and you have to come back in it to finish up what you're doing. Plus, hitting save too many times bogs the system down and makes it go slow. I will tell you, if you tab enough, you'll end up on your save button and it'll end up saving it and kicking you out. Or if you hit enter, it will actually also save. So be very careful, just tab and then click where you want to go next. Does that make sense? Okay, now, it doesn't matter what the city and state say for your patient or what that zip code is. We're going to change the zip code. The patient doesn't live in that city anymore. So instead of typing in the city name, we're going to use what we call the zip code trick and look for that city and state under the zip code table. So what I want you to do is click your binocular. It's going to open up the zip code lookup. It's going to default to search by zip code, so leave that. Click in the search for field and type 40356, and then either click your search or hit enter. When you search for a city by the zip code, you might get a lot of options. You need to be careful here and make sure you're picking the correct one. If you look, the first one doesn't have a city or state associated with it. The city and state are required fields, so don't pick that one. Okay. The second one is Beverly Hills, California. That is not right. I watched that show. That zip code is 90210. So that is definitely not right. Then Danville is your next option. That's not correct either. Lexington, that's not right. Los Angeles. And then I have Nicholasville, but it's abbreviated. We never, ever abbreviate our city names. We have to use the full city name. And then there's 3 more options. So I need to look really closely at these because 2 of them look real close, but one of them is misspelled. This one is obviously misspelled, but this one is the correct one. The other one is misspelled also. So make sure that when you're picking the city and the state off of the zip code table, you are picking the correct one, that it's spelled correctly and it's the full name of the city. Okay. So I've got it selected. I'm going to click OK. Now, if your city and state city was different, mine was Nicholasville. I'll just use that as an example. It will automatically change the city name here when you pick that zip code, the city off of the zip code table. Okay. All right. So I verified their address, or I changed their address because they had a change. If they didn't have a change, you move on to the PCP. Regardless of what it says here, you're going to ask the patient, who is your PCP? If it says none, you are still going to ask the patient, who is your PCP? All that means is the last time they were asked, they did not have a PCP. They could have gotten one by now. If it says none and they give you a name, you click the binocular and you go find that primary care physician. Okay. Search for them by their last name only. If you ask, who is your PCP, and they tell you the name that's listed here, you don't need to do anything. Okay. If there's a name listed here and they tell you somebody different, it means they've changed their PCP. You click the binocular and you go find that person. Does that make sense? Okay. Now, home telephone number. Notice it's shaded yellow. You cannot leave it blank. This is the phone number we want you to verify. The other phone numbers, we will verify everything else when the patient checks in for this appointment. But because we just scheduled it, we want to verify just the address, PCP, and phone number on the patient tab. So you're going to ask them to verify the best contact phone number, and that should be the number that's in the home telephone number field. Okay. If they do not have a phone number to replace, let's say this phone number is not good anymore, and they don't have a phone number, you cannot leave that field blank, and please don't leave that old number in there. This is the only field that Televox will use to call or text patients to remind them of their appointments. We don't want Televox to call or text a phone number that we know is not valid because we get charged for that. So what you would do in that field is you would change it to all fives. Televox will not attempt to call or text a phone number that's all fives. If you use 555-1212, so on and so forth, it will call that number. Make sure it's all fives, okay? The rest of the numbers and everything else on here, we're not asking you guys to worry about. Excuse me. We're going to go click on the account tab. Even though we made changes, we're not going to hit save. We're going to click on the account tab. And then you see account information, account type, comments, and then you see contact and type. So this area right here, under type, I want you to single click on EMG. And then you're going to ask, who is your emergency contact? What's the name? Verify the name. You're going to look at this home telephone number. What is the best contact phone number for them? And verify that number. Okay. Change it. Home telephone number is the best contact phone number for that emergency contact. If that number is not valid, please change it. Okay. To whatever the valid number is. And then you're going to come down here and look at relation to patient. And you're going to ask, what is their relationship to you? It should be listed here, but we don't have all the options for all the relationships that are out there. So if it says other, you will look in the comment section and that relationship should be listed there. Make sense? Once you've done this, on the patient tab, you've verified their address, their PCP, and their phone number. On the account tab, you've verified the emergency contact. You are finished. Let the patient go. We'll see you when you come in for your appointment. Okay. But if you made changes, make sure you hit your save button. So everybody hit your save button. Now, if the patient has insurance, you're going to get this patient registration warning box. My patient must have a lot of insurances in there on the policy tab. Doesn't matter how many are listed. You could only have one. You could have 5 like I do, or you could have 3. It doesn't matter. This has to do with the billing piece on the back end. We call this a good soft stop. It means we've got the account tab subscriber and the policy tab, the information in there correct. You guys aren't doing anything with subscriber or policy tab, but if you ever make a change, you will get this warning. So if it says, warning, invalid data was entered for patient's relationship, doesn't matter what insurance it says, as long as it says that, you're going to click OK. That's all you need to do with that. When you click OK, it will save the information you changed and bring you back to your patient information tab. You will come down here and click the button that says register. I'm sorry, we're not going back in there. You could, let me hit the X to close this because I'm not going to go back through here making changes. So my save button's not available. I'll just hit the X. Here you will either hit the X to close this or you will come down and click the button that says OK. Either way works. That will get you out of there and you are back to your scheduling folder where you started. Okay. All right, we're going to schedule another appointment. This patient came in, they saw Dr. Fonz. Dr. Fonz would like them to have a follow-up appointment with them in 2 weeks and then go to the lab and have some labs drawn. So we're going to schedule 2 appointments for this patient. What I want you to do is you're always going to start on your patient scheduling tab. You'll click your binocular and search for your patient. Okay, our patient's already here. Do you guys want to click the binocular and look for this patient again? You guys okay with searching for a patient? Just make sure patient name and date of birth, you use that exact format every time. Okay, so we'll bypass searching for the patient again. Coverage type. Mine defaulted to medical. Is that the coverage type I want to use? This patient, Dr. Fons wants to follow up with them in 2 weeks just to see how they're doing. They get over the flu. Are there any other issues that came up because of the flu? They want to make sure they're okay. So that does fall under medical, okay? I'm going to leave this department because that is the department that I want. You may have to go, well, your department should default in. I'm going to leave this location because that's the location I want. You might have to go find the correct location that you need. Does that make sense? Same with the resource. We're going to use established patient. I'm going to come down in the comment section and click in there. It's going to highlight flu symptoms. I'm going to hit my delete key and delete that out. This is where I'm going to type 2 space WK space F/U space flu. Now, you don't have to type exactly what I typed, but please put enough information in there so that anybody looking at this knows why the patient's coming in. And I use standard abbreviation. So if you're looking at that WK, you know that stands for week, right? 2-week follow-up for the flu. All right, now, since I know this appointment is not needed for 2 weeks, I am going to click my drop down where it says days and times and double click on the 19th. That will be 2 weeks from today. I don't need to see any openings until the 19th because that's 2 weeks from today. Does that make sense? That way I don't have to scroll down through there on that open times to actually find the day I want to start looking at. So I'm going to click on open times. And I'm going to say, okay, we've got Friday the 19th available. What time would you like? You know what? That Friday's not good for me. What do you got on Monday? So I'm going to scroll down. Now, notice the difference in color here. It goes from like a yellowish color to a white. Look at the day. It's separating out the days because there's so many times listed on that day. You need to know when you're jumping into a different day. So I'm going to schedule this appointment for Monday, the 22nd. Notice Saturday and Sunday aren't listed here because we don't have clinics on Saturday and Sunday. All right, I'm going to find a time on there. Make sure that you're selecting a time for the 22nd, whatever time you want to pick for your patient, and then click schedule. In the live system, when the schedule confirmation box pops up, I would print the appointment reminder and hand it to them because they're checking out, okay? And I will click OK. Now, we are checking the patient out. When they checked in, everything in that registration folder was verified. We do not need to go over there and do that. Okay, it's only when they call in, and we don't know how long it's been since someone talked to that patient to verify that, would we go verify the information in that folder. But since they're checking out, we don't need to worry about that. Okay, so that's how you do a follow-up appointment. Pretty easy. You go to page 13, other scheduling functions, lab appointments, okay? If your department has its own specialty lab that you send your patients to, or you have the phlebotomist come in there and draw the labs while they're in the room, whatever the case may be, if you're gonna use your specialty lab, you will schedule your appointment under that lab. If you're gonna use one of the other labs that UK uses for the majority of our patients, Kentucky Clinic, Turfland, or Good Sam, you will need to schedule the appointment for that, okay? Now, when you go to schedule a lab appointment, you have to make sure that the coverage type matches the type of appointment that these labs are needed for, okay? So in your case, John, you mentioned pre-transplant, then you would be using other as a coverage type, okay? We're gonna leave it as medical. Now, I want you to click in the schedule department field and type an L. We're going to use lab Turfland. Now, here's how I do this. When I type an L there, it gave me lab breast care. You can click the drop down and scroll down and find lab -Turfland and click it off of the drop down. I'm going to use the arrow down key on my keyboard to go find it. That's how I prefer to do it. I think my way is the best way, but you guys will figure out which way works best for you to navigating around here, okay? All right, I'm going to tab to the location and I'm going to type an L and I'm going to go find lab -Turfland. either using my arrow down key or the drop down. Again, if you have the drop down, make sure you click it off of the drop down. Okay. Tab to your resource, and that's going to be L lab-Turfland. So however you want to go find that, you're going to make sure that all three of these fields, the schedule, department, location, and resource, are lab-Turfland. Okay. Now tab to the appointment type and type an L, but look in your manual. We got lab 5 minutes. In your manual, Kentucky Clinic appointments are lab 10, Turfland's lab 10, Good Sam is lab 15. So keep that in mind when you go to schedule. Which lab are you using? You're going to hit the arrow down key and it'll change it to lab-10. Okay. Now, when it comes to the lab, if you turn your page to the top, page 14, it does talk about this. When it comes to the lab, there is always a referring physician. You have to attach the ordering physician as the referring physician. Unless that ordering physician is a resident or a fellow, then you will use their supervising attending as the ordering physician. So everybody go ahead and click your binocular to the right of referring doctor. And when you search for a PCP, a referring doctor, or a resource, always just do their last name. Nothing more than their last name. Now, if you're unsure of how they spell their last name, you can always do partial. So I've got Dr. Fawns, F-A-W-N-S, in my search for field. I'm going to click the search button, or you can hit enter. She is listed in here twice. Notice that both names, it's the same person, but the names are entered differently in here. We're going to use that first one. I point that out because if I had typed Fawns, comma, I would not have found her at all because she's not listed in here with her last name, comma. If I had typed Fawns space doctor, I would have found the wrong one. Does that make sense? That's why you only want to use their last name only. All or partial last name. All right, I'm going to click OK. Does everybody have Tina Fawns in their referring doctor field? All right, click in the comments. We're going to change those comments. When it comes to the lab, they don't need to know the chief complaint. They don't need to know the labs that are going to be ordered. What they want, because they'll get all of that from the order requisition when the provider puts it in. What they want is the name of the referring doctor's clinic and a contact phone number. You can abbreviate. I'm going to do a capital FCMT. FCMT, Family Community Medicine Turfland. Hit my space bar, and I'm going to type 323 space 5000. I'm not going to put a dash in there for the phone number because dashes are not allowed. The only thing that you can put in here is a forward slash. Forward slash is not appropriate for a phone number, right? Okay. Now, this patient needs to come back to the lab, but they don't want to go today because, you know, they're sick. They'd rather go get their meds and go home. So we're going to schedule this for next week. So I'm going to click the drop down, and I'm going to double click on the 8th. That'll start out my open windows time starting on the 8th and 2 weeks after that. So I'm going to click open times. Now we got lucky, and you will with the lab. The lab has a ton of appointments in there, so you should be able to find a day and a time that works for the patient, okay? Highly unlikely that you won't find one for the lab that works. Find a time on here. We're going to schedule it for the 8th, and then click the button that says schedule and stop right there. Again, we're checking the patient out. Even though I scheduled this for the lab, I would check the box to print that appointment reminder. Make sense? And I will click OK. You've scheduled that appointment. You're good to go. Okay. So we're going to go ahead and schedule another appointment. Okay. Now, what I want you to do just for practice, go ahead and click the binocular. Patients calling in, they need to schedule an annual exam for their provider. So go ahead and click the binocular. Make sure your search by says patient name and your search by 2 says date of birth. And search for the patient on the plastic sheet. Even though they're already in context, I just like to give you more hands-on searching for a patient. So remember, you're going to use the full last name, capitalized first letter of the last name. You're going to use the full first name, capitalized first letter of the last name. You put a comma directly after the last name, but you don't have to put a space if you don't want to. And then in the search for field, you're going to enter the birthday. You have to use 8 digits for the birthday. Go ahead and select their patient and click OK. And then real quick, I forgot to mention this earlier. In the live system, the system will do what we call a fuzzy logic search. So you might have more than one patient resulted here when you search for a patient. If they have similar name, similar birthday, it's going to bring that patient in context too. So you may have to look through these patients to select the correct one. Does that make sense? So if there were two Holly Thomases out there with the same birthday, you might have to ask for social or ask for an address, something else to verify the patient. Okay. All right. I'm going to click OK. Okay. So this patient has called in and they want to schedule an annual exam for Dr. Fons, with Dr. Fons. She's their PCP. It's time for their annual exam. So as far as coverage type goes, that is a medical coverage type, correct? So you're going to be able to schedule this appointment. You're going to click in the schedule department field. I'm going to type an F. I'm just going to use my arrow down key this time. Make sure your schedule department field says Family and Community Medicine Turflet. So everybody got that? All right, tab to the location, type an F, hit the arrow down key two times, I'm sorry, or use the drop down. Make sure it says Family and Community Medicine Green Turfland. Is that what everybody's location says? Tab to the resource and type FAW, and I'm going to stop right there because I get Tina Fons. I don't need to type anything else. Okay. Tab to the appointment type. I'm just going to type an E there. I'll get her established patient. This patient is established with her. They just need an annual exam. There's no referring doctor, so we're going to leave that field blank. Going to click in the comment section. I'm just going to type annual. Now, you guys could use whatever your department uses, like yearly checkup, well check, whatever. Okay. Now, when you schedule an appointment, unless you know it's not needed 2 weeks or further out, always leave this date defaulted to today's date. But in training, we have a bunch of openings. So what I want you to do is change that date. I want you to click right there and type 04/01/2021. And then we're going to pretend that we didn't touch that field at all. We left it as today's date. Does that make sense? Everybody got 04/01/2021? Then come down and click your open times. And you're going to say to the patient, the first opening that Dr. Fons has is actually not until April 1st. And the patient's going to say, well, good gosh, she's that far out. We all know our providers are that far out, right? And they may say, well, can you put me on a wait list? If your department uses a wait list, absolutely, you can put them on a wait list. I'm going to show you how to do that so that it doesn't cause issues in AEHR, okay? So doesn't matter what time you find for April 1st, select that and click schedule, and I will click OK. Now, this patient said they want to be put on a wait list, right? I'm going to go directly to the appointment activity tab, and I'm going to see all the appointments. My patient's going to follow me over. You'll see all the appointments the patient has. Future will be on the bottom. So that appointment for April 1st, 2021, does everybody see that appointment? Single click on April 1st, 2021 for Dr. Fons. Right click and select wait list. You'll get this box. You want to put this appointment, it'll be added to the wait list, and I will click OK. Now, I need to get to the registration folder because I don't know how long it's been since somebody's had contact with this patient, right? You can do it from here also. Now, if I go back to the patient scheduling tab, I would click my patient info button. But since I'm here, I'm going to do it from here. There's several different ways you can do things in the system. It's your preference on how you want to do it. But instead of clicking back on the patient scheduling tab and then clicking the patient info button, doesn't matter which appointment I'm on. I'm going to right click, and the first two options, you see appointment detail. The second one says patient information. Click on patient information. We got the same window we got when we were on the patient scheduling tab and click the patient info button, right? So come down here to the right and click on the button that says registration. Now this time we're not going to make any changes. I already showed you how to change an address. Phone number, if there's a phone number change, you just click in that field and type in the new phone number, okay? PCP, you click the binocular if there's a change there. So I'm going to click on my patient tab, and I'm going to verify their address, their PCP, and their home telephone. That's the best contact phone number, even though it's listed as home telephone. No changes to make there. I'm going to click on my account tab. Even if I did make changes, I wouldn't hit save. I'm going to click on my account tab. Under the contact section, I'm going to click on the one that says EMG. It will change this information down here to the emergency contact. And I will verify the name, the home telephone, which is the best contact phone number, and the relationship. There's no changes to any of that, so I'm done with this. I can't hit save because it didn't make any changes, right? But if I look up here at these icons, I don't see the bloodshot eyeball anywhere. So I'm going to hit the X to close that. It will bring me back to my patient information. I'm going to either hit the X or click OK, and I'm back to my appointment activity tab where I started. Okay, the next exercise we're going to do is show you the proper way to force an appointment. Okay, now if you'll go to page 18 in your manual, force an appointment, and then below that you see appointment book tab. We left that in there because if you're on the appointment book tab, you're going to see some different colors, and that grid tells you what those colors stand for. If you see yellow, it means a single appointment is scheduled in that time slot. If you see muted green, it means the time slot's available but not open for the appointment type that you may be trying to schedule. If you see green, it means that appointment time slot is open and available for the appointment type you're trying to schedule. You should never proceed on the appointment book tab to do that. You need to go through patient scheduling, open times. That day and time should show, and you would select it off of there, okay? Click back on your patient scheduling tab. You're always going to start at the patient scheduling tab. Now, reasons why you would force an appointment, obvious reason, provider's booked up, and they tell you, I need this patient to come in next week to see me, so go find a day and a time where you can put them in. You're gonna have to overbook my time slot. So you've gotten pre-approval from that provider to overbook a time slot. Never overbook a provider unless they've told you to do that. The other reason would be, and we use this example in training, but we use a different appointment type. But let's say provider comes in and says, I told this new patient to come in and see me next week. I know that I don't have any new patient appointment slots open. I've got some established time slots open, but I don't have any new patients. So go ahead and put that patient in one of those openings for established that I've got. You're going to have to force that appointment type into a time slot where it does not belong, okay? Now, when you go to your open times window, you might get openings for the appointment type, but it might not be in the time frame that provider wants that patient in. So if I were looking for a new patient and Dr. Fons doesn't have any openings for 2 months, but she told me to put this patient in next week, I would see those appointments for a new patient on the open times window 2 months from now. But she told me to put them in next week. So I would go through the process to force that appointment type into one of the openings, hopefully that she has, or overbook her schedule if she said to do it that way. Now in training, the appointment type that we are going to use is actually going to be a procedure appointment. We only put 3 appointment types in Dr. Fons' schedule in training, established, new, and then we did procedure, but didn't put any openings for that, just to show you the proper way to force an appointment, okay? So this patient, we're going to use this patient because we're in training, but in the live system, you would click your binocular and go find the patient that you're working with, right? All right, it is a medical appointment. I want you to click in your schedule department field. I'm going to type an F, and then you can either hit your arrow down key 1 time or click the drop down and select Family and Community Medicine Turfland off of the drop down. Tab to your location, type an F, and I'm going to hit that arrow down key twice, or you could use the drop down, go find Family and Community Medicine Green Turfland, select it off of the drop down. I'm going to tab to the resource and type FAW. And I'm going to stop right there because I get Tina Fons. I'm going to tab to the appointment type, and this time I'm going to type a P. I'll get procedure 40 minutes. Her procedure appointment time slots are set up in training for a 40-minute duration. Okay. There's not a referring doctor, so I'm going to leave that field blank. I'm going to click in the comment section and the chief complaint goes here. Why is the patient coming in? For today, we're just going to say mole removal. Make sure you use mixed case. Anywhere you type, make it look professional. Okay. Let's just go ahead and schedule it for today. We're not going to change that time. Now, if she did say put them in on Thursday, go ahead and change that date to Thursday. Okay. But we're going to use today's date. Go ahead and click your open times. Ignore the use book button here. Okay. You might want to look, if you got anything and you were expecting to see something, you might want to look over here at your department, location, resource. Make sure those things are correct. If they are, then that means for that department, that location, that appointment type, that resource is already booked up or they don't have any openings. Does that make sense? So at this point, Dr. Fons has said, bring them in today. We're going to click the button at the bottom that says use book. That's going to take us directly to the appointment book tab. And you're going to see some colors there, what I was referencing on page 18, the grid. But if you look at the top, there's your schedule department, your location, your resource, scheduling new appointment for your patient. It is going to be a new appointment, not a new appointment type. Some people get confused when they say new appointments, like, no, they're not new, they're established. This is going to be an additional appointment for this patient. The appointment type says procedure, and it's a 40-minute duration, okay? Now, what we see here is we see a lot of muted green. That means that those time slots are not open for the procedure appointment that we selected. They're open for established or new. So if you look right here in the muted green area, you see EPNP, established patient, new patient. All of them are 20-minute durations. And in training, you see TB, that means triple book. In the live system, you won't see a TB because no provider wants to be triple booked, okay? Now, over to the left-hand side, left of that, you see time, and then you see 2 rows with 3 little dots, and then you see 1040, 2 more rows with 3 little dots, then you see 11. Her durations on her schedule are set up on 20-minute blocks. But we've set her up to triple book, so you see the rows with 3 little dots. That's so that we can put 3 people in each time slot. You won't see that in the live system. I'm going to pick the first time slots to show you how to do it. So over to the right of 1040, where it says EPNP, I'm going to single click to select that one. Just click where it says EP to the right of that time slot, so it bolds it in black or lines it in black, shape, whatever. All right, anywhere on that row or that line that you selected your time slot, you're going to right click and stop right there. Do you see more than 2 options? If you're ever on the appointment book tab and you see more than 2 options, stop what you're doing. You came to the book tab the wrong way. Do not proceed. The system will allow you to do that, but it's going to cause issues on the back end. We don't want to cause any issues, so stop what you're doing, click on your patient scheduling tab, start there, okay? Now, we only use this one, schedule force in this time slot, so go ahead and select that. You're going to get your schedule confirmation window up, but you've got an upside down triangle, and up here it says schedule forced appointment. We are forcing this appointment into this time slot. You would either be forcing it in there, causing the time slot to overbook, or you're forcing it in there because the appointment type doesn't match what she has in her schedule for that time slot, okay? And I will click OK. Okay, that's how you properly force an appointment. Now, I kind of do this a little backwards. You can go and look at the appointment book tab all that you want, but please don't proceed directly on that tab. I like to say you can window shop, just don't try on, okay? So I want everybody to click on the appointment book tab. Now, what you're seeing is the same information we just saw because we just came from there. Up at the top, click on your appointment book tab. There you go. Now, what I want you to do is you see where it says department, location, resource, you got date, and then you have some buttons. I want you to click the button that says clear. And then I want you to change your date to Monday's date. So where it says date, make sure it says February 8th. You could always free text a date in there if you don't want to use a calendar. It's perfectly fine. Make sure you hit your clear button first. There we go. Now click, make sure the date says February 8th, and click the button that says add day. Okay. You're looking at her Monday schedule. So you could look at this and say, well, she's wide open. I can go ahead and put this person in at 9 o'clock. It's not going to overbook her, even if that appointment type doesn't fit in that time slot. Does that make sense? All right, go up and hit your button that says clear. Now let's click the button that says add week. So let's say we wanted to look at her schedule next week to see what her days are. Where can I put a patient in? You can look at the days side by side to see when the best day would be to put the patient in. Does that make sense? All right, go up and click your clear button. Now I want you to go into the schedule location field, click your cursor in there and hit your delete key. Click in your resource field and do the same thing, hit your delete key. Let's say that you want to look at today's schedule for your department, all of the providers that have a schedule there today that have patients scheduled. You want to see what their schedule looks like. Click your today button. You should get 2 columns because in training, we only have 2 providers set up, okay? So I see 2 providers schedules today, side by side. In the live system, if you have 5 providers in your clinic today, you're gonna have a column for each one of those 5 providers. Does that make sense? Go up and hit your clear button. Let's say you wanna look at Monday's schedule for your clinic. Let's change that date to be Monday's date and then click add day. And I get the same 2 providers because that's all we have in training. And I can see their schedules for Monday. Make sense how that works? You can go look around all you want, but do not, and watch the board on this. Okay, I can put this person in at 9 o'clock. So I'm going to select that slot and right click. Do I have more than 2 options? Do I want to proceed from here? No. Let's everybody go up here and click your clear button and then go click back on your patient scheduling tab. That is how you properly force an appointment to ensure that as this patient's account flows downstream, it does not cause any issues or gets kicked out of any of the systems that it's flowing to get where it needs to go properly. Okay. All right. If you turn to page 17, where it says canceling a bumped appointment and then moving an appointment, we're going to go ahead and do a cancel bumped appointment because there's only one way that you can cancel an appointment that's in a bumped status. What I want you to do is click on your appointment activity tab. Now, our patient followed us over, so we're seeing all of the appointments the patient has had, past and future, all the way back to July 2012, okay? Sometimes the patient's list is really long. You can clean it up by unchecking the appointment status of what you don't want to see. Let's uncheck acknowledged, and it will remove any of the statuses that are acknowledged for past appointments. Let's uncheck canceled. It removes those. Let's uncheck no-show. It removes those. I'm going to go back and click my canceled again. So everybody go back and click that again. Now, look down the status column. We see a bunch of cancels and schedules. Now, keep in mind that past dates in the training database should not be in the live system, should not be in a scheduled status. In the training database, we don't always get time to go back and clean these up. But in the live system, there should never be a past date. Like, for instance, this one on mine that says February 2nd in a scheduled status. Something should have happened to that appointment. They either came in and that status should now say acknowledged, or they called ahead of time to cancel or reschedule the appointment, okay? But just ignore any past dates that you see scheduled. Live system should not be that way. But let's see, do you see a status that says bumped? The one that says February 26th, it says bumped. First, let me tell you what a bumped appointment is. Provider comes in and says, I'm going on vacation the week of February 20th. You're going to tell them to go see the schedule planner. The schedule planner will go into their schedule and unblock the time frame that provider's not going to be here, okay? Any patients that are already scheduled during that time frame, the system will automatically put them in a bump status, okay? That bumped appointment needs to get rescheduled or needs to be taken care of because we don't want that patient showing up on February 26th for Dr. Fons and she's not here, okay? Now, you'll need to find out from your schedule planner, there's a couple different ways they could do this. When they go in and they unblock the schedule, it puts any patients already scheduled in a bump status. They could go ahead and reschedule those bumped appointments. If they do that, that status will say scheduled. It won't say bumped. They will send a letter to the patient that says your appointment on February 26th has been moved to whatever date they choose to move it to. Please call if that's not convenient. If the patient calls in and says, no, that day's not good for me, you will come to appointment activity. You will find that appointment. The status will say scheduled. You just right click and select move appointment and it will take you to your patient scheduling tab. You hit your open times window and give them the next available appointment. Okay, don't do that though. If the schedule planner goes in, another way they could do it is they go in, they unblock the time frame. They don't reschedule those appointments that they've bumped. They will send the letter to the patient that says your appointment on February 26th needs to be rescheduled. Please call as soon as possible. When the patient calls in, you go to appointment activity, you search for the patient, all of their appointments appear. That appointment date will still say bumped, okay? So if that day's, that needs to either be moved or rescheduled. So you're gonna right click, so everybody go ahead and right click. Now we're not gonna complete this option, I just wanna show you how to do it. And then I wanna show you the only way that you can cancel a bumped appointment. And because we only have one bumped appointment on this training patient, I don't wanna move it because then it won't be in a bumped status and I can't show you that next thing. So it's in a bump status. I get very few options when I right click, but I do get one that says reschedule bumped appointment. Go ahead and click on that. It's going to bring you to your patient scheduling tab. There's all of the information for that appointment. Usually you don't need to do anything. You don't need to change anything. You could add something to the comments if you needed to, but it tells you you're rescheduling a bumped appointment from. Now, I would go ahead and just click open times and give them the first available opening that they have, okay? I want you to click cancel so that we go back to our appointment activity tab. So on your patient scheduling tab, make sure you click cancel so it brings you back to appointment activity. And that bumped appointment is still there, right? So that's how you would reschedule a bumped appointment if they wanted, if it still said bumped and they still needed that appointment, okay? Now, let's say the patient calls in. If you look on page 17, canceling a bumped appointment. Patient calls in because they got that letter that says their appointment on February 26th needs to be rescheduled and some other information in there. But they call in, they're like, you know what? I don't need that appointment anymore. So let's just get this one canceled. So if I right click on that bumped appointment, do I see a cancel option? I see cancel, but it's grayed out, it means I can't use it. The only way to cancel a bumped appointment is you have to select appointment detail. So that first option when you right click, select appointment detail, it brings up your appointment detail window. Now over on the right hand side, the status box, there's only 2 statuses that have radio dials available. The rest of them are grayed out. The bump status that it's in now or canceled status. So let's all click the canceled status. Now, anytime you cancel an appointment, you have to come down here where it says cancel reason. Does everybody see that? Click in there. Now, if you want to click the drop down and look at those options, they don't truly match the what we have in the live system. But in this case, the patient has called in. They're the one telling me they don't need the appointment. I'm just going to type a P there. If you have the drop down open, please select patient canceled off of the drop down, even if it looks like it's highlighted. So does everybody have patient canceled in their cancel reason? Go ahead and click OK. Now, I have found in training that we can all click OK on appointment detail and Gremlins usually don't mess with us, but pickles, it got us, just about all of us, didn't it? All right. Those of us that got this message, you will never see this in the live system, I promise. I want you to click close and then try OK again and see if it works. Sometimes we have to back all the way out of it and start over. Did it work for everybody? Look at your cancel reason. Does it say cancel? That's how you cancel a bumped appointment. Okay. Now, let's say that the patient has an appointment for March the 1st. Does everybody see an appointment for March the 1st and it's on the wait list? Let's say the patient calls in. Yeah, I've got that appointment on March the 1st. I just need to cancel that appointment. So we're going to right click and we're going to come down and we're going to select cancel. You have to pick the cancel reason from the options. I'm just going to type a P there because the patient is the one that wants to cancel it. If you have the drop down open, please make sure you pick it off of the drop down. Now, does that appointment status for March 1st say canceled? That's how you cancel an appointment. Patient calls in, I've got this appointment, I need to cancel it. What I would do is if they call in and say, I want to cancel that appointment, first thing I would say is, would you like to reschedule? If they say, yeah, then move the appointment. If they say, yeah, but I'll have to call you back, go ahead and cancel it so it opens that time slot up for the next person that might need it. Okay. All right. Page 17, moving an appointment. Patient calls in. I've got an appointment on April the 4th. April 1st. I'm on the wait list, but I want to see, do you have anything sooner? So I'm going to single click on that appointment on April 1st. I'm going to right click and I'm going to select move appointment. And this works for any appointment status, scheduled or wait list. In this case, the patient wants to know, is there anything sooner than that? Okay. So there is an opening. Well, we're going to find out, but look down at the bottom. It took you to patient scheduling. It says down here, moving appointment from the day and time. I'm just going to immediately click my open times. We got openings for today. Let's just move that appointment to today. It should bring you back to your appointment activity tab. And I will click OK. Now, when you come back here, look at that appointment on April 1st. It says cancel. We did not cancel that appointment, did we? We moved it. What APM does, when you go to reschedule an appointment or move an appointment, it takes all of the information from the original appointment and moves it to the new day and cancels that original day out. Okay. How do you know which one of these appointments in the statuses that say cancel are true cancels that they did not reschedule? You have to look at the detail. So that appointment for April 1st, I'm going to select it and I'm going to right click and select appointment detail. And look right here at this cancel reason. It says rescheduled appointment, doesn't it? That's how you know. Go ahead and click OK. Let's click the one on March 1st that we canceled. Select that one, right click and select appointment detail and look at that cancel reason. It says patient canceled. So that tells me a new appointment was not made in its place. That's how you tell the difference. Go ahead and click OK. When you're looking at the status column, which ones actually canceled and which ones were rescheduled. All right, let's go ahead and talk about memo appointments. This will actually be our last exercise, guys. If you go to page 16, creating a memo appointment. Let's all click back on our patient scheduling tab. Now, let me first tell you what a memo appointment is, not to be confused with a bumped appointment, okay? And a memo appointment should only be used on a as-needed emergent basis, something that's going to happen within the next 2 weeks. And you will need to check with your manager if you will be doing memo appointments, okay? Usually departments have people designated that they want to do the memo appointments, okay? But if you are one of those people, we're going to do one in class and you'll have that hands-on. You can always refer back to your manual, okay? So memo appointment. Provider comes in and says, I've had training come up bless you, that I have got to go to Monday afternoon. I cannot miss it. It's mandatory. I got to be there. Today's Friday. We want to go ahead and place a memo appointment on the provider's account so that when we are scheduling for that provider, no appointment openings will show for that time frame they're going to be gone. Okay. Now, don't do this if they come in and say, I'm going on vacation for a week. Send them to the schedule planner. Okay. Only do this if it's an emergent as needed basis. Okay. So when you put a memo appointment on a provider schedule, it will hold out any openings from the open times window, and nobody can be scheduled during that time frame. Okay. The problem with that is once you do the memo appointment, you're not finished. You need to go and look and see how many patients are scheduled during that time. They need to be moved. I need to get a hold of them and let them know not to come because that provider's not going to be here. That make sense? Put the memo appointment on the provider schedule first before you go moving those appointments. If you start moving the appointments before the memo appointment is on there, it opens that time slot back up. And you don't want somebody to come in behind you and schedule during that time. That make sense? All right. So on the patient scheduling tab, where it says patient, you've got your three icons. You're going to hover on the one that looks like a piece of paper. It says memo appointment. Go ahead and click on memo. Notice what it took your patient's name to. It says memo. It is not a patient, right? Now, coverage type has to be other. So I'm going to click the drop down and select other. When I'm scheduling a memo appointment, the appointment type has to be other. All right, click in the schedule department field and type in F. I'm going to hit my arrow down key one time and get family and community medicine. You can use the drop down, just pick it off of the drop down. Tab to the location. I'm going to type in F and hit my arrow down key twice. Again, you can use the drop down, select family and community medicine, green, Turfland. Click it off the drop down. Tab to the resource, type FAW, and I'm going to stop right there. I get Tina Fons. Tab to the appointment type and type in H. You're going to get hold, but look, it says 20 minutes. The provider says my training I've got to go to is for an hour. So down here in this duration field, I'm just going to click right there and I'm going to type 60 minutes. That covers an hour. If it's two hours, it's 120, so on and so forth. Does that make sense? Okay. There's not a referring doctor, but in the comment section, you need to type out why you put this memo appointment on their schedule. For training today, we're going to say AEHR training. So that anybody looking at his schedule or her schedule knows where this provider is during that. And if they need to get a hold of them emergently, hopefully they'll be able to find them. Now, they said Monday, right? So where it says days and times, I'm going to click the drop down, double click on Monday. And then I'm going to click open times, just like scheduling any other appointment, except your coverage type and your appointment type is different. And you're doing a memo. So let's do Monday afternoon. Just pick a time for Monday afternoon. Doesn't matter what time, just sometime on Monday afternoon. In the live system, though, you would be picking the exact time that you want to start that memo appointment on. Okay, go ahead and click schedule. And I will click OK. You have scheduled that memo appointment. Oh, you might get this in the live system. See this box? It says this appointment cannot be scheduled. Time slot selected is no longer available. If you're scheduling a regular appointment for somebody and you get this, it means that somebody else had that same provider up, that same location, same department, same appointment type, and they picked the same time that you did. Whoever clicked OK on the schedule confirmation box first got that appointment time. The other person gets this. So we're going to click OK. Everybody that got this, click OK. Click your open times. Find another time on there. I'm going to go to the afternoon though. And click schedule. And go ahead and click OK. Now, we need to go and look and see, are there any patients that this is going to affect? Now, click on your appointment book tab. You can do it from here, but I don't like doing it from here. All right, My department's there. My date says February 8th, which is the day I want. I want to click the button that says add day. I don't normally do it from here because I would have a tendency to say, okay, this patient at 1 o'clock, that provider is actually going to be gone. So I need to get a hold of that patient. I would be too tempted right here to click on that patient, right click, and try to move it. That will cause issues. That makes sense? So what I prefer to do is go up here and click your clear button. Let's clear everything out of the appointment book tab. I prefer to go to the appointment management tab. Now, in your scheduled department field, since the default's not there, click an F and hit the arrow down key one time, Family Community Medicine, Turfland. Dr. Fons is who we put the memo appointment on, right? So I'm going to come down in the resource and type FAW and stop right there. I'm going to leave this by appointment date, click the drop down, double click on the 8th, and the second date there should default to the same day. So make sure they both say February 8th, and then click the button that says query. Now this tab comes defaulted in time order. Okay, so what I'm going to do is I'm going to go here and look, do I have any hold appointments? Here's a hold appointment. It's at 10:40. Do I have any patient names that's going to affect? No, I have an 8 o'clock and an 8:20, but I don't have anybody at 10:40 for an hour that it's going to affect, right? There's a 1 o'clock. There's a 1 o'clock and a 1:20 hold appointment. So there's a patient for 1 o'clock. That's going to affect that patient, right? So what I would do is that patient's selected. I would right click and I would go to move appointment. When I get here to the patient scheduling tab, before I do anything else, I'm going to look right up here because you have the home telephone number. Pick up the phone, call that patient and say, whatever you want to tell them, be apologetic. Unfortunately, something emergent has come up. The provider is not going to be here. We need to move your appointment. And you're already on the screen that you want to move it to. Everything's already filled in. We're not going to do this. You would just click open times, pick the first available day to move this appointment to. Does that make sense? Go ahead and click cancel. It'll take you back to your appointment management tab and you can move on from there. Make sure any patients that are going to be affected during that time frame have been moved. Okay. All right, let's go click back on our patient scheduling tab. Notice I never touched that registration folder. I didn't need to. The only time I would ever do it if I was one of you guys and the patient calls in and says, you know what, I changed my phone number. You could do it from here, look for the patient, and then click on patient info, or you could go straight to your registration folder, look for that patient, go to the patient tab and change their phone number. Does that make sense? Or change whatever needs to be changed. All right, I'm going to click back on patient scheduling. You might not get that very often, so. Okay, we are actually finished with training. Well, all the exercises that we do in class. You have your manual. Now, you guys probably already have access to APM from taking the APM View Only Printing WBT. If you haven't checked yet, you can go back. When you go back to your area, you're going to click on your start menu, okay? And you'll go to ambulatory and you'll click on APM Prod. Now, you guys won't see APM Prod on those training computers, but notice it's logging me in because I'm logged into this computer under my credentials. So I'm not going to get a login page to type anything in. It's going to automatically log me in under my link blue. Okay. If you get an error when that login page comes up, it means they don't have your access set up yet. You could go ahead and call the help desk and say, I took that APM View Only Printing WBT. I should have access to APM and have them check the status. Okay. Now, if you do get in, then you're good to go. Except, well, come on, it's going a little slow. In the patient scheduling folder, so I'm going to go open the patient scheduling folder, appointment scheduling. The 4 tabs that are available, you'll be able to access any of these tabs except for the appointment book tab. The appointment book tab will be grayed out. You won't see anything. Does that make sense? until they get the roster from today's class, which I'm going to submit it over here in a few minutes, and they start working on it. They will go in, and if you've already got the view only access, they'll update your access. It's going to take 2 to 3 business days to update your access or give you access. If you just don't call when you go back and you don't have it, they'll give you access from the roster. When you see that appointment book tab available, if you do have access, they've updated your access and you can do everything you need to do in here, okay? The other thing you won't be able to do is in the registration folder. When you get over there, you will not be able to make any changes. So if you go to the patient tab, you won't be able to make any changes until they give you your full access. You can look at the information, you'll see everything, but you won't be able to make any changes, okay? All right, I'm going to log out by using the Bloodshot Eyeball. Okay, so we're all going to log out of APM. You're going to hit your Bloodshot Eyeball. And yes, we are sure we want to log out. And then it's going to bring you to this page. You're going to hit the X to close that, and it'll bring you back to your desktop. And that concludes training. So if you guys ever have any questions, please feel free to reach out to one of the trainers. We're on the front of the manual. Or you can always call the help desk, 323-8586, the same number you call for everything. And if they can't help you, they'll get somebody on the APM team that can assist you. Okay? All right, guys, thanks for attending.